Nate McCrory. I'm Center Director for our Center for School Health and also Assistant Dean for the Division of Kinesiology, Health, and Sports Studies. It was a wonderful dinner last night with the session organizers and some of the community groups that came into the area for the event. Today has been wildly popular. It was nice to have folks from Robert Wood Johnson as well as the U.S. Department of Health and Human Services and local groups talking about all of what's going on in the city around health equity, programming, evaluation, and community dynamics. You know, I really hope that there is follow-up with this type of an event where it can be a sustained conversation, where real change can happen, where community groups are uniting to start to develop a multi-sector approach to increasing the health environment in Detroit. It's exciting. The type of thing doesn't happen very often. Wayne State has made a unique commitment to the city of Detroit and in the area of wellness and opportunities for citizens in the Detroit to lead healthy lifestyles. And so I think that's exciting, especially when you bring together groups from so many different organizations together around the table to have meaningful dialogue.
Hi, I'm Pedro Jordan, and I am the Director of Community Engagement with Wayne State University. I'm here today to be a part of the health equity movement in the city of Detroit. Part of my role as the Director of Community Engagement is to work with community organizations and academia to bring them together to help improve the health outcomes of our citizens and residents in the city of Detroit and the county of Wayne. The conference is wonderful. There's been quite a dissemination of information. There are some areas that I did not or was not very informed on that has been quite enlightening, and areas that I intend to look into and that I feel will improve the work that I need to do in the community.
Yeah, I'm JJ Tai. I'm the CEO of the Michigan Fitness Foundation. Well, first, I think it's great that we've got this conference. I think it's the start of many in the community. For us, it's about bringing as many partners together to have the conversation about health equity, how we focus on improving health of the citizens of Detroit and other cities around the state of Michigan. It's been great. A good diversity of speakers, from different sectors of whether they be business or nonprofits or state agencies or philanthropic organizations. So I think it really gives a diverse perspective on the challenges we face in creating that culture of health and really making a difference in the community. Well, I think it's a great start. I think there's a lot of work ahead. I think we have to figure out a way to keep the momentum of what's being talked about, working with the health department in the city of Detroit, working with the different philanthropic organizations, so everybody plays a part, but keeping that connectivity and making sure we're working together and collaborating, not necessarily working in the silos that typically happen, so we can actually make a difference in the community.
My name is Leslie Welch, and I am Deputy Director at the Detroit Health Department. So this Mayor Summit on Health Equity is an opportunity for folks in the city across different barriers of our institutions, academic and community and public sector, to collaborate on what is so important to our city, the health of our city. And I'm participating as a facilitator for one of the work groups this afternoon on accessibility and mobility. The speakers have been awesome, both the keynote speakers and the speakers from the community. It's been very eye-opening to listen to panelists whom you've been in maybe meetings with sometimes but don't know about the scope and scale of the work that they do and how they contribute to the city, and about opportunities to partner in ways we hadn't considered before. I am most looking forward to how the ideas and commitments and inspiration that is coming forth today is operationalized as we move forward in the future.
Yep, I'm Trish Dewald. I'm the Executive Director for Danielle Kermanis' Work It Out. I'm quite grateful to Wayne State for pulling together the mayor and so many tremendous health experts from around the nation to talk about health equity, and what our community can do to really move the needle on that. It's awesome. It's really been great. Tremendously illustrious lineup of folks. I mean, just when you begin to think that Detroit's a community that's so small and you know everybody doing all of the good work, you come to an event like this and meet new folks doing really big, really important work. So, for me, a takeaway is that there's still so many people to learn from in our town doing good work. I'm looking forward to the working groups, and then from there figuring out what we can do together to implement anything to move the needle on health outcomes for our kids, primarily in our community. Healthy babies make a good city.
Sure. I'm Peter Hammer. I'm professor of law and director of the Damon J. Keith Center for Civil Rights at Wayne State Law School. It's an incredibly important issue to bring the city together, the university together, and community stakeholders to think about public health and health disparities. Probably the most important single issue that could bring a range of issues from transportation to income to health to education to violence to crime and make progress in a positive sense is a holistic vision of public health that puts on the table expressly the notion of health disparities and the role that structural racism has played in producing the sets of challenges that we face today. Well, the whole point of this afternoon workshops is to start to get people to say, we've had some nice theory in the morning, where are we going to go after this? So focusing on intersectoral issues, so mobility and transportation, environment, breaking the cycle of poverty, and saying, if we want to think about how these impact on health and how health can impact on these issues, what are the connections, what are the leverage points that we could to identify, what are the priorities, what are the action steps, and very importantly, what are the collaborations that can come out of a conference today and move us forward. So this is not just a one-day event, but rather helps to find a template that can take us to a more equitable future. Speak specifically to the Damon J. Keith Center for Civil Rights, we're focusing on structural racism as this generation's civil rights challenge. So what we can help do is provide a framework that says, how did we get here? What is the role of race in policy? And then how do we use policy and law to move us forward?
My name is Anthony Holt. I'm a chief of police at Wayne State University as well as associate vice president. This is a really crucial conference that was called by the president of Wayne State University as well as the mayor of Detroit. This president at this university is very active in community, especially minority health disparity. He asked me to be on among all these doctors and PhDs is because as police officers in the Midtown area which we serve, we are really the first responders. So any aspect of real community policing is you get involved with the neighborhoods and the people. And one of the ways to break down barriers to get involved is to create programs of physical activities, where we want the community not to view us as a proponent of the criminal justice system enforcing laws, but as rather partners with them in creating this healthy community. So we have walk clubs, we have a bike with the police officers, we have boot camps. We take seniors, for example, who live in the Jeffrey Project areas, and we have let's get a walking club where the third of the month when your checks come in, police officers will be part of your walking club. You're gonna walk to the bank. From there, you're gonna walk to Whole Foods. So we put that safety aspect around it. So we see those who might want to take advantage of this, and well, the police are with them. So we try to create this thing where we're empowering certain groups in the community to come out, walk, ride your bikes, and we're out here with you.